If you have normal oxygen levels but still feel like you can't catch your breath, this video is for you. Many long COVID patients experience this. They feel like they're short of breath, they're air hungry, they just can't catch their breath, their breathing is manual, and then they go and they put a pulse oximeter on and it reads completely normal. And I know that this is very frustrating, frightening, and just know that you are not alone. I'm a nurse anesthetist and I deal with oxygen and breathing every day. And my husband has long COVID and has been struggling with this for about 3 years. I can tell you this is something that he experiences frequently, at least a few times a week. And sometimes he can be just laying down and feels completely short of breath, and it'll go on for hours. I'll ask him how he's feeling and he just says, I feel like I can't catch my breath. Puts pulse oximeter on, it's totally normal. So then, of course, he starts to feel like he's imagining it or maybe something's really not wrong. But let me tell you, just because the pulse oximeter is normal doesn't mean that there's not something wrong or that there's not something going on. And we're going to dive right into that. So the first thing we should talk about is what the pulse oximeter is actually measuring. It's measuring the amount of oxygen that is being carried in your red blood cells. So think about it as almost like your fuel tank gauge. So just because you have a lot of gas in your tank, that won't matter if your engine isn't running properly. So that's kind of what's happening with your body. You've got all this oxygen in your bloodstream, but your body is not able to use it. And we're going to talk about why that is. So the first thing that happens is you breathe in your air, right? That air travels down, it goes into your lungs, which is very vascular, and there makes it like an air exchange, okay? The oxygen moves into your bloodstream. Then that blood travels down to all your extremities, all your organs, and then it transfers that oxygen over to all the tissues and cells at that site. So again, the amount of oxygen in your blood is not the problem. The problem comes in at the exchange, and once it is exchanged, your body's not able to use it properly. So one of the first things is the mitochondria, okay? The mitochondria is what's called the powerhouses of the cell. They create all the energy that you need for basically everything that you do. Patients with long COVID have mitochondria dysfunction. Their mitochondria is damaged, and so it's just not able to function properly and use the oxygen like it should. And so that's one way or one reason that you're feeling breathless, because what happens is the brain senses, okay, the mitochondria are needing more oxygen. Let me cause this person to take more breaths to supply it with more oxygen. But that's actually not the problem. There's enough oxygen in your bloodstream. It can't use it like it should. But it's still creating that feeling of like you need more oxygen, even though you don't. Now, the second issue is dysautonomia and breathing pattern disorders. Now, you have, as part of your nervous system, your sympathetic nervous system and your parasympathetic nervous system. The sympathetic nervous system is your fight or flight. Parasympathetic is your rest and digest. Now, in a normal person, or well, really with everybody, but in a normal person, the brain is monitoring the amount of carbon dioxide that is in the blood, and it determines how fast or how slow or how quickly you should be breathing based on those levels. Well, with a patient that has long COVID, this system just kind of goes haywire. So a lot of times patients with long COVID develop what's called hyperventilation syndrome, where you're actually breathing too much without realizing. You start taking these rapid, shallow breaths and you're blowing off too much carbon dioxide. This creates the feeling of air hunger, even though you're over breathing. So now your brain is saying, well, you have these low levels of carbon dioxide, making you feel like you need more air, which is creating this vicious cycle, because then you're keep breathing faster and blowing off more, and then it's just a terrible cycle. One of the reasons too that you might be taking these kind of shallow breaths is because of the diaphragm. The diaphragm is innervated by the phrenic nerve. Well, if this has any kind of damage as part of your dysautonomia, that can create this issue where the diaphragm is not contracting as efficiently, or allowing your chest cavity to expand as much. So when you are breathing, it's breathing these little shallow breaths. And that's also creating this feeling of being breathless. And it also means that you're working 3 times as hard as somebody else, and you're not having as efficient of air exchange. And you will excuse me, I wanted to make sure you guys know there are times where I glance down to look at my notes because I want to make sure that I'm getting all of this information correctly. So you will see me occasionally glance down at notes just to make sure that I'm getting all the information. So along with all of this, the dysautonomia is that sometimes it can trigger your sympathetic nervous system inappropriately. So it's putting you into this feeling of fight or flight when you don't need to be in fight or flight. And so that's going to create that feeling also of those rapid, shallow breaths. Your chest feels tight and you feel air hunger. Problem is that looks a lot like anxiety. And your physicians may think that you're just anxious, and that's the reason that you're feeling like you can't take a deep breath. But that's not what this is. I mean, I will tell you this, you might experience some anxiety because you feel like you can't take deep breaths or because you feel like you can't catch your breath. But anxiety is not the root cause of what's happening. There is actually something happening in several different parts of your body that is creating this feeling. And then the result may be that you're anxious. But I feel like sometimes doctors just think you're anxious, and that's the cause of all of this. And that is not what's happening here. So dysautonomia, that is just the dysregulation of your nervous system that is causing you to have these shallow breaths. You're not getting enough air in, and you're blowing off way too much CO2, which is also making you feel like you need to keep over breathing and creating this vicious cycle. Like we talked about, the diaphragm is also not contracting as efficiently, creating these shallow breaths. And if you're feeling like you're in fight or flight, that's also making you take these really shallow breaths. So it feels like you're just not getting enough air. Another thing that might be contributing to this is the POTS. A lot of people with long COVID have POTS, which is postural orthostatic tachycardia syndrome. With this is when you go from laying to standing and your heart rate jumps up. And basically, your blood is pooling in your lower extremities, like your legs, okay? They're not compressing enough to push that blood up to your brain fast enough, which is why your heart is beating really fast. It's like, oh my gosh, we've got to get the blood up there. But what's happening is your brain is not sensing enough oxygen at that time, and that may make you feel like you can't catch your breath as well. So just know that is a contributing thing as well. Also know that this dysautonomia does not turn off when you go to sleep. So sometimes people may wake up and feel like they're gasping for air. Just know that that's why, that there is this dysregulation of your nervous system that's still happening at times when you're asleep. So if you are waking up kind of gasping for air or feeling short of breath, just know that might be one of the reasons why. Another thing that could be contributing to all of this is just the microvascularization dysfunction also. So when the blood goes down to the tissues, there still has to be this exchange of gas from the blood vessels into the tissue, which happens with these really small blood vessels. Well, sometimes those blood vessels are damaged because of long COVID, and that exchange is not happening as efficiently as it should. So some of those tissues are feeling oxygen starved, if you will, or just that they're not getting the same amount of oxygen that they should, which, the body is smart and not smart in a lot of ways, but it has a feedback loop so that it's telling you, oh my, we need more air, we need more oxygen, because these tissues aren't getting all that they should. So you can see how all of these things are working together to create this feeling like you need to be taking in more breaths, even though the amount of oxygen in the blood is adequate. Also know that post-exertional malaise will contribute to this as well. So if you have gone out and overexerted yourself, and sometimes that looks like, walking across the parking lot or just overdoing it with housework, whatever that limit may be for you. But if you go over that, that's going to also make you feel really short of breath. Again, and your oxygen levels may be normal, but as your body is trying to kind of compensate for that, it's going to contribute and make you feel short of breath as well. So what can be done about this? Well, there's a couple of things. One of the first things would be there are some vagal nerve exercises that you can do, and it may sound silly, but there are things like humming, gargling, singing, and specific breathing exercises that stimulate the vagus nerve. They may help restore some autonomic function. There are also some vagal nerve stimulating devices out there. I will tell you, I can't speak for how well these things work, but just know that there are some that are out there, and it is worth exploring. I might look into kind of doing a video about that in the near future. Salt and hydration helps a lot, especially if you're experiencing POTS symptoms. Just having more volume in your vasculature will help a lot with the POTS symptoms, which, if you can get that under control, will help with the breathing. Sometimes there are medications that will help with this, like what's called beta blockers, which will lower your heart rate. That can sometimes help with this. And I know this, one that probably doesn't sound very fancy, but is just respiratory retraining. And it's really important to work with somebody who understands dysautonomia, so they can tell you the proper type of breathing techniques that will help combat some of this. So that's really important. Even sometimes just changing positions. There are different positions that will help you breathe better and feel like you're taking deeper breaths. Along with that is also pacing yourself. I know everybody out there with long COVID gets really tired of hearing pacing, but it is really important to not overdo it and to learn how to pace yourself and help breathe better, and maybe use some of those different breathing techniques to help with all of this. So that's about it for today. Just know that you are not alone, and just because your oxygen levels are normal doesn't mean that there's not something going on, that there is something wrong, and what you're experiencing is valid. So please leave me comments. Let me know if this is something that you're experiencing, what things have helped you with that, what things haven't helped you with that. Also, let me know if there's other videos that you are really wanting me to do. I've got a lot of things planned, but I'm happy to move things up sooner in the list. So just let me know. Thanks for joining me.